Well, I think of June 16th of 2009. It's a day that I'll always remember. I got a phone call from a friend, and he said, Norm, you got to get to the high school. Your son's down. Teddy's down. And he said, Norm, it's serious. They're doing CPR on him.
Just a normal school day, normal little 14-year-old boy, and just heading out to gym class, and he suddenly collapsed without warning. He didn't even know that he was in trouble. Cardiac arrest strikes so quickly that the victim never even knows that they're in trouble.
Coach! Somebody call 911.
I got it.
911, what's your emergency?
I don't know. There's a student on the ground. The coach said to call someone. He may be having a heart attack. Coon Rapids High School, door 13.
Kids go into cardiac arrest every day. The problem is the grown-ups around them don't recognize it as being cardiac arrest because they think there's no way this healthy kid, this indestructible kid, could go into cardiac arrest. That this young, healthy child is dead in front of them because their heart stopped beating. Because seizures look like cardiac arrest, and because cardiac arrest looks like a seizure, treat it like a cardiac arrest. You're going to see that patient collapse without warning. You're also likely going to see something like their wrist coming up and curling in. This is called posturing. Another thing that you're going to see, most likely, is agonal respirations. Now that's like pulling a fish out of the water. It's the mouth that's opening and closing. You might hear some snoring, you might hear some gurgling, you might hear some gross groaning noises. But these are all typical, common things with cardiac arrest. CPR is not a civic duty, it's a moral obligation. Everybody is obligated to do CPR. If I'm 16 years old and I'm with my buddy and he collapses, that's my job. It's my obligation as that 16-year-old to save my buddy's life. This is your friend. This is your classmate. If you don't do something as a student, as a 16-year-old, as that person's buddy, then the next time you're going to see your buddy is at his funeral. If you've seen CPR on TV, you know how to do CPR. The only thing you're doing with CPR is you're putting your hands right in the center of their chest, right on their breastbone. You're going to push hard and you're going to push fast. You're going to push the chest halfway down to the ground, half the thickness of the chest you need to push. I need you to do this 100 times a minute. The easiest way to remember how to push down 100 times a minute, sing the song Staying Alive.
Here. We need an AED. Ready? Let's
If there's more than one of you,
2, 3.
then send somebody to go get the AED while you start CPR and call 911. If it's just you and the AED is within 2 minutes of you, go grab the AED because that's the thing that's going to save this person's life. The only thing you need to do with an AED, with any AED, regardless of how it looks, turn it on.
Call for help now.
Once you turn that AED on, it's going to tell you what to do. It's going to give you voice prompts.
Come on, stay with us.
Remove all clothing from patient's chest. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Do not touch patient. Evaluating heart rhythm. Stand by. Preparing to shock. Everyone clear. Press flashing button.
Shock button now.
Shock delivered.
Wait, something's going on. All right.
this. You're at the school.
There's a number of reasons why Teddy is alive. The school that he attended was prepared. They had an emergency action plan, and when Teddy went down, his coach thankfully kept his head and knew what to do. They followed the cardiac chain of survival, which is recognizing the signs and symptoms of cardiac arrest, getting the 911 emergency EMS people called, as well as asking for a defibrillator, which they knew they had in the school. And ultimately starting chest compressions, keeping his brain, heart, vital organs alive, bought time to get that AED as soon as possible. He was actually saved before the police or the EMS arrived. Certainly, life would be different without our son. So many parents aren't as fortunate as we are. They've lost their kids. You know, we're just thankful.
His story didn't end in the hallway of his school. And his story didn't end in that hallway of his school because his classmates and his teacher saved his life. They recognized what was going on, they took immediate action, and they saved his life. When it comes to cardiac arrest, you've only got minutes, just a couple of minutes. And those couple of minutes, you're not gonna have emergency services there. You have one shot to get this right.